10 to 15% of couples struggle with infertility, and this can take a huge toll on your emotional health and on relationships. If you've been trying for a year or more without success, talk with your doctor, because thanks to modern medicine, we do have reproductive technology that has allowed many couples to achieve their dreams of having a baby. The type of treatment that's right for you will depend on the specifics of your situation. You can expect your doctor to sit down and talk with you and your partner about your lifestyle, about your medical history, and after asking you a ton of questions, they'll decide what treatment would be best for you. Cost is also another concern that a lot of couples have, and they can review that with you, and cost varies so much based on where you live and a few other factors. One very common cause of infertility is the fact that the woman isn't ovulating, and sometimes this is due to certain medical conditions, and so the doctor will work with her to see what they can do to treat that or address those issues. But they can also stimulate ovulation by giving the woman medication. And then if the woman takes the medication and times intercourse just right with ovulation, then success rates are actually pretty high. In fact, studies have shown that about 40 to 45% of women who ovulate after taking medication that stimulates ovulation then go on to conceive and have a baby. One of the biggest pros to this type of treatment is that it's relatively convenient and cost effective. It can range anywhere from $60 up to $6,000 per cycle, depending on whether or not the medication is in pill form or it's an injectable medication. But there are side effects associated with it as well, and some of them aren't so pleasant. It can cause bloating, headaches, hot flashes. Those are just a few of the things. So if your doctor recommended it for you, they would go over all of those side effects in detail so you know what to expect. Another option that the doctor might consider is intrauterine insemination, also known as IUI. And this is really good for couples where the man has a low sperm count or they aren't very good swimmers. And so sperm is actually injected directly inside the uterus. And sometimes fertility drugs are used in combination to stimulate ovulation and increase the chances of it being successful. Success rates are about 15 to 20% with IUI, and over the course of 6 cycles, it's as high as 60 to 70%. So it doesn't always happen the first time, but with a few tries, most people get pregnant with it. A pro is that it can be done in the doctor's office. A con is that it can lead to multiple births, and for some people, actually, they welcome this because they've been trying for so long, they would just love to have multiples. The cost on average is about $865, but again, this can vary greatly depending on where you live and what facility it's done at. Another type of fertility treatment is in vitro fertilization, also known as IVF, and this is where eggs are extracted from the woman's body after taking medications to stimulate that process, and then those eggs are mixed with sperm in a lab setting, and it forms an embryo. That embryo is then implanted back inside the woman's uterus, and if there are extra, they're stored for later in case that cycle isn't successful. This is best for older couples who have been trying to conceive for a while, those who have struggled with infertility for a long time and we can't really peg down the explanation. It's also helpful for couples where the man has very poor sperm quality. This does increase the chances of a couple being able to conceive a baby. Success rates vary by age. So the younger a couple is, the more likely it is to be successful. Couples who are 35 and younger have a 41% success rate. Between 35 and 37 years, the success rate is 32%. And then beyond that point, it's about 23%. There are drawbacks associated with IVF. For one, it's very physically demanding and taxing on a woman's body. The fertility drugs that she needs to take can cause undesirable side effects. They can also cost a lot of money, the drugs and then also the IVF procedure itself. On average, it costs $8,000 plus the cost of medication associated with each cycle. So for most couples, this is their last option because they try less expensive options first. One other potential drawback is the fact that, again, it increases a couple's chances of having multiples, twins or triplets. But again, for some, this is welcome because they've been trying so long and they'll take 2 for 1. Good luck with it. I hope the best for you. And if you have more questions in the future for me, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms and recommend us to your friends and family too.